Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. Today is June 16, and I'm here for today's COVID-19 update. The state is reporting 60,064 diagnosed cases of COVID-19 and 5,772 deaths statewide. Here in Kent County, as of this morning, we're reporting 4,102 diagnosed cases. That's an increase of 15 over yesterday's official number, and 112 deaths here in Kent County. That's actually one death fewer than we reported yesterday, and that's because we continue to look at the case and the death data to make sure that the addresses are correct and that cases and deaths are being attributed to the right county, and so we've made a correction there. Lots of comment yesterday about masks in the video that we produced, and politics and people's personal opinions. And to be clear, when I make my recommendations for public health, I'm not thinking at all about politics. I'm not thinking about left versus right. I'm thinking about the science. I'm thinking about what we know about COVID-19, how it's spread, and trying to empower people with the best information that we have at that time. I think it's unfortunate that whether or not you wear a mask or not has become a sort of litmus test for your politics. I think that the president has done some really great things and some mistakes. I think that the governor has done some great things and has also made some mistakes. And I think the same can be said for all of us in public health. And I think it's important that we have tolerance and patience for one another. I think that it's important that we recognize that everyone is trying to do the very best they can to serve our nation, to serve our community, and to make sure that we protect one another and that we can minimize the amount of damage this does to the health and well-being of people, to the health and well-being of our economy, and to our nation overall. And I really encourage everyone to have patience, have some consideration for one another. We're not trying to infringe upon anyone's constitutional rights. We're not trying to have government overreach here. We're merely trying to share information and empower all of you to protect yourselves, your loved ones, and all of us in the community. Some questions from yesterday. One about face shields. And if masks were good, why not wear face shields too? Well, actually, a mask works much better for arresting the aerosols that contain the COVID virus. And so masks should always be worn in public by those who can when we're in proximity to others. A face shield is a different tool for a slightly different purpose. It works good as a supplement to a face mask in certain situations where a person is in continual close proximity to others in a way that can't be avoided. So I don't recommend face shields in general, except for those certain circumstances where a person is really forced by the nature of their work to be very close to others all the time. Question about herd immunity, and shouldn't we actually be exposing all of our low-risk people, our young, healthier people to COVID, so that they build immunity and that we build herd immunity as a population? It's a good question, and it's something that's actually been explored in Sweden and in some other nations. And what they have found is not very promising, to be honest. They have not flattened the curve at all, and they actually see a death rate that's much higher than similar nations. Other Scandinavian nations, for instance, have much lower death rates than Sweden does. And they have not been very successful in actually developing that herd immunity. When Sweden has done tests of the population to see how many people have that antibody, they actually find very low percentages. I think it's less than 5% of Swedes have the antibody to COVID-19, suggesting that it has not been effective in developing herd immunity. So that's all for today. Please keep those questions coming, and I'll do my best to respond to them. And I encourage you to stay positive, stay heroic, stay healthy, and I'll talk to you again tomorrow. Thank you.